So in this video we are going to talk about the applied anatomy of the lower cervical spine from C3 to C7. In other words, cervicobrachial area. Now, this is the continuation of the previous two videos. Now, lower cervical spine or cervicobrachial area, any pathology in that spinal area will lead to pain, in the radiating pain into the upper extremity. It can be just a pain in the neck region or sometimes even both. The other signs and symptoms of lower cervical spine pain can be restricted range of motion, headache, altered sensation, altered dermatome and myotome lesions, paresthesias, and even sympathetic dysfunction. Now we'll see the facet joints. There are 14 facet joints in the cervical spine area from C1 to C7 in pair. So in clinical examination, sometimes the upper two facet joints in the thoracic spine between T1 and T2 are often considered in clinical examination. Now, if you see the articulation of a facet joint, so superior facet joints in the cervical spine faces upward, backward, and medially, whereas the inferior facet joints of a cervical spine faces forward, downward, and laterally. Now, this articulation provides primarily the flexion extension movement. Now, at the same time, it prevents the side flexion and simple rotation movements. But in cervical spine area, none of these movements are isolated. Side flexion and rotation. These two movements will always be together. That's why this is called as a coupled movements in the cervical spine area. Now, HGI reported that between C0 and C2 and C7 and T1, these coupled movements are in opposite direction. But the rest of the cervical spine from C2 to C7, the coupled movements always goes together in the same direction. Now, these joints move primarily by gliding movements and classified as a synovial joint or a diarthroidal joint. Now, flexion extension in a cervical spine can be seen highest in range of motion at three segments: C4, C5, C5, C6, and C6, C7. Highest flexion extension can be seen at C5, C6 level. Now, the higher mobility comes with a cost. So, there is a greater amount of range of motion at this three level. Flexion extension will lead to degenerative changes in the later ages. Now we'll see the resting position, closed pec position, and a capsular pattern for a cervical spine. So the neutral position or a resting position for cervical spine is midway between flexion and extension. The closed pec position for a cervical spine is complete extension. And a capsular pattern for a cervical spine is rotation and side flexion and equally limiting extension. Now we'll see the nerve roots or nerve innervation. So recurrent meningeal, or in other words sinovertebral nerve, innervates the anterior dura sac, posterior annulus fibrosus, and posterior longitudinal ligament. Medial branch of the dorsal primary rami innervates the facet joint. So this nerve carries the pain sensation in case of arthropathy in the facet joints. Now, if you see the ligaments in the lower cervical spine, the main ligaments are anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, supraspinal and infraspinal ligaments. The intertransverse ligaments, or the ligament between the two transverse processes in the cervical spine, is in a rudimentary phase, so not developed fully. Thank you. In the coming video, we are going to talk about intervertebral disc in the spine.